Welcome to our special segment. I'm Madison Kasper. Here with me is Dr. Chad Perlyn, Executive Vice President and Chief Medical Officer at Nova Southeastern University and Executive Medical Director for NSU Health. Welcome, Dr. Perlyn. We're honored to have you.
It is great to be here this morning. Thank you.
So with all of your background, you could have went anywhere. Why choose to come to NSU?
When I think about my career, as you know, I'm a pediatric plastic surgeon. I've operated on nearly 10,000 children at this point in my career. At some point along the way, I became a healthcare leader, and I realized I've done so much healthcare with my own two hands that as a healthcare leader, I could suddenly do healthcare through 350 sets of hands of the doctors who I helped oversee and lead when I was at Nicholas Children's as an administrator there. And over time, as I thought about my career and my direction, I realized ultimately the most impactful way that I could help change our community, help change healthcare, having practiced with my own hands, having helped other physicians practice with their hands, was to make sure we have amazing healthcare professionals for the future. And that ultimately is what brought me back to the university, knowing that at this point in my career, I can be helping other young people start their careers and enter a profession that I've absolutely loved being a part of, healthcare. Nothing could be more meaningful to me now.
You talked about growing and expanding. What is your vision for NSU Health?
Right now, when you look at NSU, our educational footprint is tremendous. It's powerful, it's impactful, and we are the best at education. Where we have opportunity to grow is in the clinical care, in the delivery of care to patients. And Dr. Moon loves to say, and I agree completely, the best medicine is in a place where you treat, where you teach, and where you research. And that is what we are looking to create for NSU Health. And we will do it. We will build the academic medical center. We will build the environment which will change the landscape of South Florida by allowing more access for our students to be in world-class places, more access for patients to receive that care, and more access ultimately for our community to flourish economically as a result of improved healthcare.
So you just spoke about teaching, and back in 2010, you had helped in the Haitian relief effort. So what would you say is your medical value that you really want to pass down to students?
I never thought that I would be a leader. I grew up wanting to be a physician, wanting to be a surgeon, became one, and in 2010, January of 2010, the earthquake in Haiti happened, and it's now remarkably 15 years ago, so many people have forgotten or were young, but this was a catastrophic event, and there were hundreds of thousands of people who were injured or killed. I was brand new. I was as green as the green screen behind us. I knew nothing about leadership. I'd been trained as a surgeon, but I was maybe 6 months out into practice. And I saw on the television the suffering of other people. And I saw the injuries. And in this moment between my wife and I, which we talk about often, I still don't know if it was a question or a statement. She said, "You're going, aren't you?" And I did. And I volunteered to lead one of the very first teams of pediatric surgeons to Haiti immediately after the earthquake. That experience fundamentally changed my life. As I said before, I didn't know what leadership was, but I knew what service was. And I knew when you have a skill in this world and there are others who need it, I understood the obligation to share that skill and deliver that service. That put me on a very different track. I'd always imagined I'd be a surgeon scientist and have a career operating in the operating room and researching in the lab, but that experience and the time thereafter really took me on this hard right turn into healthcare leadership. And I looked back, and 15 years later, I had become the president of the physician organization at Nicholas and the senior vice president of the Nicholas Children's Health System, and really found myself in this leadership role. From there, now to bring it back to your question, from the Haiti earthquake to teaching, through that experience, I just understood again this responsibility. And just like I knew I had a responsibility to treat those patients, I really believe in the responsibility that we have, particularly in medicine, to pass on this body of knowledge.
So NSU also has very strong arts and humanities programs. So how do you see their involvement in patient care?
Well, I think that this is one of the most wonderful things about the opportunity we have as a university-based healthcare system. There are many fantastic hospitals and clinics and healthcare systems. But when you think about what we have to offer patients, what we have to offer the community, by putting together things like the arts program, things like the humanities program, arts in medicine, for example, the NSU Art Museum, opportunities to do mental health. We did a great program recently with patients, faculty, staff around painting. So there are just so many neat ways to incorporate the resources of the university and to integrate them as we think about healthcare, that it's fun to see what we'll continue to do.
Thank you so much for being here today.
My pleasure. This was fantastic, and thanks for having me on Mako TV.
This has been our special segment. I'm Madison Kasper. See you next time.